Failure to Thrive Part 2. We're going to discuss the contributing factors that lead to failure to thrive. So as mentioned in the first video, that we can have an organic cause or a non-organic. And we typically separate these into there's a physiologic or physical cause to it or a psychosocial cause. So the physiologic is going to be from numerous GI disorders. So there can be something like Crohn's disease, esophageal atresia, where the child can't eat, pyloric stenosis, where the child is throwing up repeatedly, those type of things. And so what these signs and symptoms are going to be is fatigue because of lack of nutrients. They may have nausea. They may have a poor appetite. I mean, even think about the hem-onc kids where we're giving them chemotherapy agents that make them feel awful. And the last thing they want to do is eat, and therefore they lose a lot of weight. There can be a craniofacial abnormality, poor suck and swallow coordination, and this is very common in our preterm infants. And then we can have a lot of GI abnormalities. On the psychosocial side, i.e. the non-organic, this has to do with who's feeding the child what. So there might be self-feeding difficulties, that the baby doesn't know how to do it and nobody ever taught him, or the baby isn't getting any good nutrients to begin with. And that's the very last one. Poor dietary habits, lack of routine meals, overconsumption of junk food that really has poor nutrients in it. And so this child is not thriving. There can be feeding resistance. So once again, this would be our preterm infants who have had endotracheal tubes, oral airways, numerous NG tubes, medications put into their mouth, and the last thing they want to do is put their food in. And they didn't know how to suck because they were born too early. Somebody's been working with them, and they just don't want to eat. We have our children who have the short gut syndrome who have not been able to eat. All of their nutrition has come via TPN and lipids. And then one day when their gut starts functioning because it grew a little bit and now it's absorbing, they're thinking that they can absorb their nutrients the way they should. And this kid is looking at you like, food? I don't even know what food is. Even though they've been smelling it and watching other people eat, they won't do it. In our older children, so our school age and our adolescents, of course, the eating disorders in the form of anorexia nervosa as well as bulimia can lead to failure to thrive. Now, we're not going to discuss that in peds beyond what I just said because you've already had that content in 171. There can be other psychosocial problems. There can be anxiety about eating. They're afraid to. Every time I eat, I get a belly pain, or every time I eat, I have diarrhea, or every time I eat, I'm nauseated and I want to throw up, and I'd rather not eat than throw up, that type of mentality. When we look at another arm of the non-organic causes, we're looking at family, society, as well as culture. There may not be money to be able to put food or formula on the table for this child. Feeding nutritionally incomplete foods and fluids. And so this is an example. The parents only have so much money for the month. They get paid once a month at the beginning of the month. And now we're at the 25th of the month, and there's very little formula powder left in the bottom of the can, and there's no money in the bank to be able to go and buy more. So what they do is, instead of putting 2 scoops to make a bottle, they'll do 1 scoop and they'll make 2 bottles. So essentially that child is only being fed water. And if it's the 25th of the month and they're not going to get paid for the next 7 days, this child is already very calorie deficient. In addition, they might decide, well, you know what, we don't have money for formula, but we do have regular milk for the rest of the family. Well, infants are not supposed to have milk until after the age of 1 year. And so they may end up having diarrhea because they're taking milk. Feeding an infant rice water instead of formula. There's very little nutrition that's in that. And then on the other hand, inexpensive fast food and convenient foods. And so this is going to be more for your toddlers and your preschool age children and your school age children, where you can get McDonald's, you can get that Happy Meal for just a couple bucks, whereas more nutritious food might cost more. And then, of course, we have skipping meals. Family's too busy. Oh my gosh, I have to go to work. Oh well, we'll catch up later. In America, there is a profound lack of knowledge related to what comprises in regards to what is good nutrition. Neglect, failure to provide adequate food. So the parents just don't put food on the table. There's a little bit and it's got to go a long way. And then poor eating routines. Looking back on the organic, we can have chronic vomiting. So on the physical side, we have pyloric stenosis, reflux. So an ounce goes down and a half an ounce comes back up. So that child only got half the calories. When you look at how many calories are in an ounce of formula and there's 22, well, that kid's only getting 11 calories. And then severe GI infections where all nutrients are being dumped into the toilet, either through vomiting or diarrhea. Medications, chemotherapy, and radiation also affect the GI tract. Chronic diarrhea creates a malabsorption condition, and it can be exacerbated by formulas if the child has a hard time breaking it down, if they have a whey, and that's WHEY, intolerance or a lactose intolerance, then they have chronic diarrhea as well as abdominal pain. It can be therapy related, where they've had a transplant of some sort, and it impairs their ability to digest and absorb. We have malabsorption conditions. So remember back when we talked about respiratory, cystic fibrosis. They lack enzymes. If they don't take them prior to feeding, they're not absorbing their nutrients. Celiac disease, short bowel syndrome, and then there's a lot of other malabsorption syndromes, but they're not that common. And then the last contributing factor is increased use of the calories. So chronic illness causes an increase in the stress. The stress causes an increase in the metabolic rate. So the child has two arms contributing to the failure to thrive. They're not taking in foods because they don't feel good, and then the illness that they're trying to overcome has caused the stress response, and so they're burning what minimal calories that they put in. So your chronic respiratory illness, where there's always an increased work of breathing, that's burning up calories. Cardiac disease, profound amount of calories are burned just in trying to get that heart to circulate and to keep the respiratory tract going. And when they have congestive heart failure, they're in a lot of distress. And then other examples would be cancer and recurring seizures that takes a lot of muscle energy every time they have a seizure. There's an increased need for additional calories to treat certain type of diseases. Trauma, so auto versus pedestrian, where this child has head injuries and fractures, they need extra calories, and then of course burns. And last but not least, we have excessive exercise. So our anorexics who think that they are just too fat, they go out and they run, and they do not put in enough calories. So this ends part 2 of failure to thrive.